The generic formulations are required to demonstrate the bioequivalence to prove the therapeutic similarity and therapeutic equivalence. Sometimes single dose bioequivalence studies are required, and sometimes multiple dose or steady state bioequivalence studies are required. So this video is regarding the conditions when the multiple dose studies or steady state bioequivalence studies are required and are mandatory for the generic formulations. I welcome all the viewers to this video, and this video will be a short video and very informative to understand about the multiple dose B studies. So when it is required, first is modified release formulation. If the generic product is a modified release formulation and it is indicated for the chronic use, then you can do multiple dose bioequivalence study, or you will be required to demonstrate bioequivalence through steady state studies. Also, if the modified release formulation shows accumulation upon multiple dosing, that time steady state studies are required. Modified release formulations should demonstrate bioequivalence, and it is required to compare the rate and extent of absorption under steady state conditions, especially for the formulations like modified release formulations like extended release ER or delayed release DR formulations. Then second is the time dependent pharmacokinetics. When the drug displays non-linear kinetics because of the enzyme induction or inhibition over time, then the steady state studies are required to understand the true bioavailability. Then if the formulation shows high intra-subject variability for the drugs with high variability in a single dose PK, steady state may reduce variability and provide better sensitivity to have the bioequivalence. Drugs with long half-lives, instead of prolonged single-dose studies, which may take weeks for washout, steady-state studies with loading dose will have the shorter intervals. Then drugs for chronic use. Regulatory agencies may require bioequivalence studies under steady-state conditions to better reflect real-world uses. Then for the drugs products which show flip-flop kinetics. When the absorption rate is slower than the elimination rate, then steady-state data may provide better evaluation of the bioequivalence. Another criteria is the safety of the formulation or safety of the drug. If drug is indicated for some diseases like cancer, that time if the drug is cytotoxic and study is required to be done on patient, so to have the patients in the study, the patients which are indicated the same treatment can be enrolled or are required to be enrolled, and that time multiple dose study or steady state study is required. Now see the study for multiple dose or steady state when it is not required. If the formulation is immediate release formulation and drug with linear PK, then generally multiple dose study is not required. Single dose study can suffice the requirement of bioequivalence. Drugs with short half-life and no accumulation. Regulatory guidance, US FDA and EMA recommend steady state studies where clinically justified, especially for the MR formulations. It is not like that all the MR formulations are required to show multiple dose B studies. Often it is accompanied by the multiple dose B parameters like AUC0 to tau and steady state, Cmax steady state and Cmin steady state. Then fluctuation index is required to be demonstrated. This was the short video on the topic when steady state B study is required or when the multiple dose B study is required. Thank you for watching the video.